Mr. Speaker, across our land, there is outrage at national health insurance companies, private health insurance companies that are denying claims for heart disease, denying claims for cancer, denying claims for diabetes. Mr. Speaker, the average cancer patient in America will lose their entire life savings in 2 years. 42% of Americans who have cancer lose their life savings in 2 years. Mr. Speaker, 18% of Americans have had their health care claims denied. Over 3.4 million Americans. On a very small matter, I had my health care claim denied by United Healthcare when I wanted to get a $100 nasal pump for allergies. Back it came denied, and I couldn't get that reversed. Imagine people with more serious problems. One of the people who died in my district, Sarah Boughton, she died of a sinus infection because her health insurance companies denied her claims for basic health care. As Americans face denial after denial after denial, what is happening with these private insurance companies? Let me tell you, $1.4 trillion in revenue, $70 billion in profits for the top 7 private insurance companies. Now, they say, oh, it's only 5% profit, but it's $1.4 trillion sucked out of our economy while basic Americans are denied health care. And what is this money going to? It's going to administrative costs. It's going to advertising. It's going to bloated executive pay salaries. While we can't give people treatment for cancer, for diabetes, for basic health issues, the American people are outraged, and they're rising up across our country demanding fundamental change to a broken health care system. Enough. Here are 3 things that we could do. First, if a doctor prescribes a medicine, the private insurance company must cover it if Medicare covers it. That is common sense. Second, let us cap out-of-pocket costs so you don't have someone who has cancer depleting their entire life savings. Cap those costs at $2,000 a year. Third, let us make sure that these private insurance companies can't rely on AI to have AI-generated algorithms that deny claims. No AI used to deny Americans claims. But really what we need, Mr. Speaker, is what so many other democracies have. We need Medicare for all. The reality is the average American is paying more than $6,000 a year on health care costs. And those premiums are up 7% from last year. We're not going to get those premiums down. We're not going to get those health care costs down unless we have Medicare for all. When we have Medicare for all, we will have 2% administrative fees. Medicare will be able to negotiate with the hospitals, negotiate with the pharmaceutical companies to lower costs for all Americans and provide care. And guess what? If we have Medicare for all, every doctor and every hospital will be in-network. No more of these denied claims that are bankrupting Americans and taking people's lives. Mr. Speaker, I represent a district in Silicon Valley that has $12 trillion of value. Apple, Google, NVIDIA, Tesla. We're producing more wealth in my zip code than any place in human history. How is it that in the wealthiest nation in the world, when we're producing more wealth than ever before, Americans can't get basic health care? Health care is a human right. We have the money to make sure every American is covered and not denied. It is time for change. It is time to hold private health insurance companies accountable. It is time to fight and pass Medicare for all.